what would you use? Is there some home remedies you can use, or this is something that when it's contagious, it's automatic, over the counter?
No, so just contagious meaning, it can be transferred from person to person, but it can be cured and can be treated. And so getting into treatment, there are some things you can try at home. And the thing about warts is that no one thing works 100%. There's a lot of treatments for warts out there. And so one of the most common things that, you'll hear people do, there's really no research behind it, but using duct tape. A lot of people will use duct tape. And the theory behind it is that it kind of suffocates the wart. You wrap it with duct tape, you leave it on overnight or for several hours and do that, for 1 to 2 weeks or so. Some people have had their warts go away with that. And I'm not sure it's actually the duct tape or it's just time. And it just coincidentally, you've been using duct tape and then it goes away. But a lot of people will use duct tape. Now, they have a lot of over-the-counter remedies for warts. The main thing that's in common with most of the over-the-counter remedies is they have something called salicylic acid in them. And so salicylic acid acts basically as like a blistering agent. And so you put it on the wart and it causes kind of the skin to bubble. And then the way it works is that the infected skin kind of goes away. It sloughs off and just comes off. And so that's the way it's supposed to work. But a lot of times the over-the-counter preparations with salicylic acid may not be strong enough. They can only sell a certain strength over the counter, but the main ingredient in all those medications usually is going to be salicylic acid for it. Now, you do salicylic acid, you try the duct tape, you try the little wart remover, it's a little pads, the compound W, the freeze, you can freeze it, the cryotherapy, like I say, a lot of that stuff, it'll work for like fingers. Because usually when the wart is on a finger, it's not quite as thick and as deep because we don't walk on our fingers, we walk on our feet. So the tissue just gets deep, gets thicker. So that stuff a lot of times doesn't work quite as well for warts on the bottom of the foot. What I found to work the best and what usually with telehealth, how I treat, I tell everybody, to get like one of those like little pet eggs that you can get from, that kind of helps to take some of the skin off. And then I prescribe them a topical medication that has a combination of salicylic acid, something called 5-fluorouracil, cimetidine, and urea. So it has like 4 main ingredients in it. And the reason I use this is because I have to get it from a specialty pharmacy to get the high enough dosage and to get all those medications mixed in. And all of those medications, they cause the blistering, but also the urea will cause the skin, the built up skin, to go away. And it basically eats away that skin that's built up. So all the other medications can get to the wart to get rid of it. And, it's pretty painless. People do it for about 2 or 3 weeks, and usually their wart goes away. And so, I've found it very beneficial treating patients with telehealth. They can do it mostly themselves at home. I prescribe them the medication. It comes to their mailbox, and then they put it on, and they've done very, very well. That's opposed to, going somewhere in person, or either getting it, cut out, which you can do. You can actually take a knife and actually cut the thing out. But I mean, who wants to get numbed up with a needle? You get it cut out, you have a wound, you can't walk in it for a long time. And then of course the expense of just going somewhere to get it done. Or they have like lasers that can do it too. But again, you're looking at scarring and things of that nature. And a lot of times a laser is pretty expensive to do as well. And so, with this combination topical, I really had good results with getting rid of people's warts. They don't have to go somewhere, and they don't have to go into the knife for it either.